When did your doctor learn that medical licenses aren't immunity? Dr. Nathan Graves told me I was being dramatic about my heart palpitations in September, even though I'd come to his office 3 times in 2 weeks describing the exact same symptoms. Racing heartbeat that lasted for hours, chest pressure that made it hard to breathe, dizziness so severe I'd nearly passed out twice at work. I was 28 years old with no history of anxiety or panic disorders. I told him I knew the difference between stress and something physically wrong with my body. He smiled in that condescending way doctors do when they've already decided you're wasting their time and said stress could cause all sorts of symptoms people didn't recognize. He suggested I try meditation and maybe cut back on caffeine. I explained I'd already eliminated caffeine completely and the palpitations were getting worse, not better. He typed something into my chart and said he'd prescribe a low dose of anxiety medication to help me relax. When I asked about getting an EKG or seeing a cardiologist, he actually laughed and said I didn't need to see a specialist for stress-induced symptoms. He told me that ordering unnecessary tests would be a waste of my insurance company's money and his time. He printed out the prescription and handed it across the desk, saying most of his patients found that once they addressed their anxiety, their physical symptoms resolved on their own. I took the prescription but didn't fill it because I knew something was genuinely wrong with my cardiovascular system. The palpitations weren't triggered by stress or worry. They happened randomly throughout the day and night, sometimes waking me from sleep with my heart racing at what felt like 200 beats per minute. I started documenting everything in a journal: date, time, duration, what I was doing when it started, associated symptoms. After another week of episodes happening multiple times daily, I called Dr. Graves' office and asked to schedule a follow-up appointment. The receptionist said he'd noted in my chart that I should try the anxiety medication for at least 30 days before coming back. She suggested I give it time to work. I explained I hadn't filled the prescription because I was certain this wasn't anxiety. She put me on hold and came back saying Dr. Graves recommended I find a therapist to work through my health anxiety before scheduling another appointment. Health anxiety. He'd actually written in my chart that I had health anxiety. I asked to speak with him directly, and she said he was with patients all day, but she'd leave him a message. He never called back. 3 days later, I was standing in the kitchen making dinner when my heart rate suddenly spiked so high I could see my chest visibly pounding through my shirt. The room started spinning, and I grabbed the counter to keep from falling. My vision went dark around the edges, and I felt like I was going to die right there on the kitchen floor. I managed to call 911 before I collapsed. The paramedics found me unconscious with a heart rate of 230 beats per minute. They transported me to St. Mary's Hospital, where the ER doctor took one look at the EKG and immediately admitted me to the cardiac unit. I woke up in a hospital bed with electrodes stuck all over my chest and an IV in my arm. A cardiologist named Dr. Patricia Osei came in and asked how long I'd been experiencing these symptoms. When I told her 2 months and that my primary care doctor had dismissed it as anxiety, her expression went completely flat. She pulled up my EKG results on the computer in my room and turned the screen so I could see it. She pointed to specific patterns on the graph and explained I had supraventricular tachycardia, a condition where the electrical signals in my heart were misfiring and causing dangerous rapid heartbeats. She said it was completely unrelated to anxiety and required immediate treatment. Dr. Osei asked if I had copies of my medical records from Dr. Graves. I told her I could request them, and she said she wanted to see exactly what he documented about my symptoms. She explained that SVT was usually diagnosed with a simple EKG, which should have been the first test ordered when I described cardiac symptoms. The fact that he dismissed my complaints and prescribed psychiatric medication instead of doing basic cardiac screening was, in her words, deeply concerning. She said I was lucky the paramedics got to me when they did, because sustained heart rates that high could cause stroke or sudden cardiac death. I asked why Dr. Graves would tell me it was anxiety when a simple test could have found the real problem. Dr. Osei's response changed everything. To see the full story, click the link below or go on my channel.